Good afternoon. My name is Dr. Lennox Forrest. I'm your psychologist for today. Today we're talking about a very important subject, which is suicide. And suicide affects all of us in many different ways. The reasons for suicide is very complex and varied. Pinpointing the exact reason for suicide is always challenging. Unfortunately, suicide is the second leading cause of death for individuals between the age of 10 and 24 years of age. In the United States, I believe the statistics showed that in 2017, 47,000 Americans took their lives. That's a significant number. And I also believe that in 2017, 1.5 million Americans attempted suicide. So suicide often most occurs when stressors and health issues converge to create an experience of distress, hopelessness, and despair. At the individual level, there is never a single cause of suicide. There's always multiple risk factors. So one always has to look at suicide warning signs. So the first thing I'd like to say in terms of a warning sign is that if someone is actively talking about suicide, making statements, gestures, take note of that. That's a good indication that this person may be contemplating taking their lives. So the important factor is if someone is talking about it, take it seriously. And you may want to engage in a discussion with them about their thoughts, their feelings about suicide, what's going on with them at this particular time. The other warning sign is their behavior. If there's a change in the behavior of the person, for example, someone used to be calm, relaxed. Now you're seeing someone who's exhibiting some impulsive tendencies. They may look to become easily agitated, very angry. Pay attention to that particular sign. So if you see a major shift, a major change in a person's behavior, that could be a pretty good indicator. You also want to look at the person's mood. For example, if a person who is fairly happy, easygoing, all of a sudden you see their mood where they're depressed, they're having problems getting out of bed, they're exhibiting a lot of anxiety, a lot of worry, a lot of consternation, take that sign as a change in their mood. And the mood is an important sign to be able to see, because usually it's readily available just by looking at the person, by talking to them, you'll realize that the mood has changed. So you'll see the person's mood may become very depressed, maybe very anxious. They may not exhibit any interest in certain things that they used to like to enjoy. Also, they're just withdrawn, they're isolating from family and friends. Look at that as a significant indicator of what's going on. Okay? Another sign that you probably want to take a look at is any health factors. Are they using substances? Are they getting drunk? Are they getting high? Are they up all night? So these are health factors. You also want to assess the person's physical health challenges. Have they had a significant operation? Have they been diagnosed with a physical illness? Are they experiencing a considerable amount of pain? Those types of things are important things to be able to look at and assess for yourself. You also want to look at what we call environmental factors. For example, does this person that you know have access to a gun? Obviously, if someone has access to a gun and they're feeling depressed and they're suicidal, there's a good possibility that they may act on that. So if there's a gun, you may want to lock that up. You may want to take that away so that the person doesn't have that particular access. In terms of other environmental factors, you want to look at prolonged stress. Is this person experiencing significant stressors in their lives? For example, are they going through some major financial crisis? When people don't have monies, sometimes that can really weigh them down mentally. So you want to look at that particular factor. You also want to look at the fact if there's tremendous stress in their lives. Have they broken up with someone? Has there been a divorce? Has there been separation? Has the family system broken down? Is there separation? Family members not communicating? That can cause significant stressors on someone. So you just want to look at what's going on in their environment. Have there been exposure to suicide? For example, has a friend of theirs taken their own lives? So if there's a loss in that particular area where a good friend committed suicide, that might be a factor for this person to commit suicide as well. You also want to look at historical factors. And what I mean by that is that, has this particular person attempted suicide before? Is this a first suicide? Is it a second suicidal attempt or a third suicide attempt? So you want to assess the degree of that history. You also want to look at, is there a family history of suicide with this particular person? For example, as a father, a brother, a sister, some family member taking their own lives. So you want to look at that particular history because that can be very, very important. Then you also want to assess for what we called childhood trauma. Has this person been physically abused? Have they been sexually abused? Have they been emotionally abused within their family system or just within their experience? So you want to see if there's been any neglect or any type of trauma within that person's family. So assess all of those areas seriously. And once again, if someone is talking about committing suicide, engage with that person and hear what they're talking about. Obviously, if someone is talking about it, actively speaking about suicide, do they have a particular plan in order? And if that plan that they have is very, very specific, in such a manner that there's tremendous specificity, that they know exactly how they're going to do it, how they plan to bring the suicide about, then you know that this is very, very serious. So you want to get that person help. One way to help is to call the American Foundation for Suicide Prevention. And that phone number is 1-800-273-8255. So be able to recognize these signs and symptoms. In today's society, when we look at social media, you want to assess if someone is being bullied. Are they being attacked by others? You also want to look at, is this person going through any gender identity struggles? Because once again, individuals who are experiencing that tend to be very, very vulnerable to committing suicide. So assess all of those areas, and if you do that, that will give you a lot of information. But the first thing is, once again, be ready to talk and be able to connect the person to some type of treatment. Because when there's treatment, at least the person is getting some help. Hopefully they're able to talk to someone, they can open up with someone and be able to just gain an understanding of what's going on. And a lot of people, unfortunately, tend to be very hopeless today. and they're isolating themselves. And with social media, it's easy to spend time on your cell phone for a couple of hours without knowing that so much time has elapsed without having that face-to-face contact with someone, which is very, very important. So once again, if someone is thinking about suicide, if you know someone who is acting very, very differently, be willing to intervene, talk with them, and connect them to services, and hopefully they can make contact with a professional who's in a position to help the person and help them to realize that suicide is a temporary solution. That suicide is a permanent solution to a temporary problem. Thank you. All right, as we look to conclude, I would like to make an appeal in terms of a call to action. Suicide is a significant, I just froze for a moment. Suicide is a significant problem in our society, especially when it comes to young people. There's a researcher at the U of M, her name is Cheryl King. I believe she's been doing research for about 30 years on suicide. Here's what comes out of her suicide program. Teenagers nominated adults to be what was considered to them a caring person in their lives. What came out of this is that this would increase the social connectedness with these individuals who are looking to commit suicide and adult individuals who they decided to partner with in terms of a caring person in their lives. When young people have a caring person in their lives, the research shows that the suicide rate will go down. In our society, we need more caring people. Now, if you can make a commitment to be a caring person to another, that's going to inoculate that person's propensity to commit suicide. So that is my call to action for you, for myself, is to look to be a caring person. Because in this society, no man is an island, and that rings true. So be committed to be a caring person so that you and I can make a difference in someone's life. In the Hebrew, we say, Ve'ahavta le'raka kamoka. And what that means is that, and you shall love your neighbor as yourself. So go out and love someone. Be a neighbor. Be a caring person to someone's life. And that alone is going to produce and make a difference in their lives. My pleasure once again. I've been your psychologist for today, Dr. Lennox Forrest.